Okay, so we've connected with our patient Hani today. Hani, first of all, I wanted to thank you for participating in the telehealth education program.
Thank you, Dr. Kahn, for seeing me today.
Yeah, it's my pleasure. So the nurse did speak to you and obtained a consent for telehealth. I wanted to just ask you very briefly, do you have any questions about some of the limitations she mentioned?
No, she went through everything, and I'm good with what she explained to me.
Okay, great. Now, before we start, can you hear me okay? We have a pretty good connection.
Yeah, I can hear you just fine.
Okay, and you can see me just fine?
Yeah.
Excellent. Yeah, we have a pretty good connection. A little bit of background. If, first of all, if at any point you cannot hear me or the screen freezes up, please let me know. I'd be happy to repeat myself.
Okay.
We're basically using telehealth to get connected with you, to get you the care you need without exposing you to the coronavirus. So it's actually working out very well.
Good looking out, Dr. Kahn.
Yep. Thank you. I appreciate it. So we were talking about your headaches, and it seems like you're doing very well on your topiramate. It's working for you, and you have no side effects. And overall, your headaches are improved.
Yeah. So I did feel a little drowsy the first the first couple of days. I felt like I was a little bit drowsy, but then after the first couple of days, I felt like I went back to normal. But my headaches are a lot better.
Okay, great. I'm going to actually fast forward to the physical examination component. So we have a chief complaint of headaches. This is basically a straightforward headache follow-up. He's doing well in medications. So this is basically a screening neurological examination with elements of the general examination, as well as the cardiovascular and pulmonary components. And so from the cognitive standpoint, I really do not need to go into a lot of depth. We've already established that he's communicating well. There's no slurring of speech, and that he's, following basic commands. And so we're going to go ahead with the cranial nerves. So I'd like you to, Hani, I'd like you to focus on your eyes. If you could bring the camera up and look at your eyes. We're going to look to see if your pupils are symmetric.
Is that close enough for you, Dr. Kahn?
Yep, that looks great. Okay, so your pupils are symmetric. And while we're there, if I could have you actually lower your lower eyelid like this. Okay, great. And same thing on the other side. Okay, good. So that looks clear. I have you go ahead and look up at the ceiling. Look down at the ground. Look to the right. And look to the left. Okay, good. I'd like you to give me a big smile. Good.
Where's Waldo?
Yeah. Have you stick out your tongue?
Stick my tongue out?
Yeah.
Sorry.
Okay. And we actually jump straight to the throat examination as well. We can go ahead and have you say ah. Good. Excellent. So we got a very good view. A little bit on the throat examination. That's one of the sticking points in telemedicine, is getting a good view. A couple tips. Sometimes I like to have the patient go over to a window with lots of natural lighting. That's one quick and easy way to assess the throat. A flashlight or a phone with a flashlight and a family member helping out is also helpful. Sometimes it works, sometimes it does not. However, in general, having a family member, a friend, or a caregiver assisting with the examination definitely can help. So you don't have any numbness in your face?
Not that I know of, no. I feel normal.
Okay. When you touch your face like this, it feels about the same on both sides?
Like that? Yeah.
Yeah, it's about the same on both sides.
I'm a little lighter in my hair than I thought, but yeah.
Okay. I'd like you to shrug your shoulders for me like this. Okay, good. And I'd like you to hold your hands out like this. We're going to do one hand at a time. I'd like you to hold your hand out.
How far out do you want me to hold like that, Dr. Kahn?
Yep. You
Okay.
can lower it a little bit. So, yep. And I have you go ahead and take your finger and touch the tip of your nose, touch the top of the phone, touch the tip of your nose. So pretty good coordination. Now, I know you do have, we'll do the same thing on the other hand. I know you do have Charcot-Marie tooth.
Wait, you want me
disease.
to like that, palm out?
Yep. So he has anti-gravity strength. You can go ahead and touch your nose, touch the tip of the phone. Good. So general coordination's okay. Sometimes I'll have him actually touch your ear.
You want me to touch my ear?
Yep. And touch the tip of the phone. Good. Great. Excellent.
You want me to touch my hair too?
Yep. Sure. Why not? So the general idea here is, and we did notice some atrophy, and that's something that's a chronic chronic condition for you, right? So that's
It's just been something I've been dealing with for a long time. You know that.
right,
So
right. And we're going to focus on your headaches today. You're getting around okay?
yeah.
All right. I'd like you to stand up. Okay. I'd like you to close your eyes for a minute. Your balance is okay?
Yeah.
You don't feel dizzy or lightheaded?
No.
Okay. Let's have you put your feet together.
Can I open my eyes, or do I have to do it with my eyes closed?
Either way.
Okay.
We're going to put your... Yep. Now you can close your eyes. Okay, good. You can open your eyes. You feel okay? Your balance is fine? If I was concerned about falls, I definitely would recommend having a family member or caregiver next to the patient. Let's go ahead and have you take a few steps.
Forward, right?
Yep.
Okay.
Okay, we'll have you turn around and come on back. Okay, you can go ahead and sit down. You feel okay? You're getting around just fine?
Yeah.
Okay. I know with your CMT, you've been doing very well. You don't wear the braces any longer, and you're actually getting around okay. You're still working full time and everything.
I can run a 6-minute mile. No, I'm just playing. I can't run a 6-minute mile. But I get around all right.
Overall, you're doing okay.
Yeah.
Good, good, good. So a couple things here. I'd like you to take a big deep breath for me. Okay, breathe out. Good. No pain when you do that.
No?
Good. It seems like you're breathing comfortably.
Oh, yeah. And especially since I quit smoking last year, I'm breathing a lot better, definitely.
Good for you. You definitely seem like you're breathing comfortably. And with regards to your vitals, I do have your height and your weight and your body mass index here. If needed, we could always have a blood pressure cuff at home and have you check your blood pressure and heart rate. Sometimes palpation of your pulse or just checking your pulse can also be done if it's relevant to the visit as well. So those are some things with virtual telehealth. With certain programs, they actually have remote monitoring devices that can send the data directly to your provider. Those are some general notations. I'd like to check a few things here. If you could put your hand right in front of the screen and show me your fingernails.
Like this, Dr. Kahn?
Yeah, so we can see your fingernails and your hand. You do.
Do you want to see every fingernail?
Just your hand in general will be fine.
Oh, okay.
We do know you have some atrophy. We'll look at the other side. Okay, so no cyanosis or major clubbing. Okay, great, excellent. Now I'm going to include a link to some other resources that have organ-specific examinations and some tips regarding patient self-examination. Now, regarding patient self-examination, there are ways to instruct the patient, for example, to palpate their abdomen or to perform components of the musculoskeletal examination. So I will include a link to those resources. With regards to self-examinations, my opinion is that the positive or negative findings should be taken with a grain of salt. And so if there is any question about a finding or a lack of finding on the examination that warrants further assessment, definitely a face-to-face visit would be warranted. So the telehealth examination it's something better, definitely better than a nurse's note or a simple telephone call. It's not a substitute for a face-to-face visit. However, for simple visits like this, where essentially we're going to refill topiramate, we've assessed there's no major other problems going on, it will suit the purpose. Hanny, what we're going to do is we're going to have the nurse give you a call after you get off here. She'll call you to arrange for your follow-up, and we'll go ahead and schedule a 6-month follow-up. Okay. I will put in for your Topamax, so I'll go ahead and put in for the Topamax for your 6 months worth of refills. If you have any problems or questions, you can call us anytime. And I wanted to thank you for participating in the program today. Did you have any questions for us today?
No, thank you. Thank you for seeing me today, Doc.
Okay, my pleasure.
Have a good day.
You too.